Bore good morning, and welcome to this Cardiff University webinar. This is the latest in our new series of webinars under the title of Informing Policy, where the University will be providing space for Cardiff University academics to speak directly with policymakers on a variety of topics where their research expertise can inform policy development. Today's policy webinar looks at the Cardiff Model for Violence Prevention. This is a collaborative public health strategy to prevent violence. It relies on the strategic use of information from health and law enforcement organisations to improve policing and community violence prevention programmes. The model has already been implemented across England and in cities in the United States, Australia, South Africa, South America and Jamaica, but has yet to be implemented in Wales. Professor Jonathan Shepherd CBE will take us through the model, with Jonathan Drake, Director of the Violence Prevention Unit for Wales, offering frontline insights and reflections on the presentation.
Thank you. The objective here is to do all we can to keep people safe by ensuring that the benefits of this model are realised across the country. So, as a surgeon who treats people injured in violence, we have to start with people who are harmed. So this guy is a teenager. He was attacked by somebody with a Stanley knife. It just illustrates how violence is disfiguring, it's frightening, it blights cities, it disrupts health services, and it costs us all a fortune with the cost of policing, the courts of criminal justice system, A&Es, local government across the board. And it also has serious mental health impacts, not just physical harm, but mental harm. And 40% of people, research shows, who are injured in violence develop post-traumatic stress disorder. Flashbacks, difficulties sleeping, depression, all the rest of it. This young lady, another one of my patients, was attacked by her boyfriend. Now, this is the basis of the Cardiff model. And it's important that for each data item that we share, that it has a purpose in it. So at least 50% of violence which results in emergency hospital treatment is not known to the police. And police knowledge of violence depends on injured people reporting violence, but many don't report. They're frightened of reprisals. They don't want to have their own conduct scrutinised. People who are involved in the drug trade, who are intoxicated on a regular basis, who are in gangs, who carry weapons, they are at high risk of being injured in violence, of course, but naturally they're not going to go to the police, or rarely go to the police when they get injured. So this is the basis of the Cardiff model, and it's well researched and known across the world now. So what are the implications? Well, the implications are that information, specific data from A&Es could be used to measure violence. That's not really the topic today, but most importantly, to prevent violence. And that's the basis of the Cardiff model for violence prevention. And now here are the key features. So it's a simple process, but these steps need to be joined together and led well. So it's continuous data collection by A&E receptionists on precise violence location, the time of violence, the weapon used, and numbers of assailants, and the relationship between the injured person and their assailant. You know, was it a family member, an acquaintance, a stranger? And we find that, especially from research in London, that if there are more than one assailant involved, then that can be a signal for gang activity. And then these data are all anonymized, depersonalized, and shared, and then combined with police data, summarized by an analyst or analysts. Public Health Wales are contributing to this well, though there's still work to be done. And then these data are translated into practical prevention by a violence prevention board. And that involves statutory community safety partnerships and supported by violence reduction units, of which there are 18 across England and Wales, and one which John Drake leads in Wales, but funded to prevent violence in the South Wales Police area. Now, this is an example of the workaday, day-to-day data. This is the Cardiff Model data in the week beginning the 10th of January 2022 in Cardiff. And just going down the list of assault locations. There are schools here, Cathays High, Easton High. There are particular streets here. Another school, the Knaps Skate Park. So real detail here about where precisely the violence is taking place. Hollybush Pub, and then in the home or someone else's home. The date of the visit to A&E, the weapon used, and then the relationship between the injured person and their assailant, and then the numbers of assailants. And you can see here that there are a number of these assaults in that particular week, not uncommonly of 3 or more assailants. So this is the Cardiff's Violence Prevention Board, which James Dunn, who's a consultant in the A&E at the University Hospital of Wales, now chairs, and I had the privilege of chairing for 2 decades until 2018. Not going to identify all these people, we'll talk about each of them in turn, but they are representatives of the local authority, of South Wales Police and the NHS in Cardiff. And if I can just pick out one person particularly, here's the chief analyst, Peter King, at the time, really key front row person in telling us each month, each quarter, where the violence is happening, where it's concentrated. And there's an accountability for prevention that builds up in a group like this. So this is a city level, community level violence prevention board, which is part of the Community Safety Partnership. Needs to be replicated across Wales. It doesn't happen at the moment. So a couple of examples, just day-to-day practical prevention. This is the top picture here is bottom of Bute Street in the Cardiff Bay area. That was identified solely from A&E Data as a hotspot for violence, and a CCTV camera was installed to facilitate police intervention and deterrence, and violence in that hotspot fell as a result. And then the second example is the castle grounds in the centre of Cardiff, where there's a lot of actually homophobic violence, and with the Parks Department, the Violence Prevention Board worked with partners to cut down the shrubbery here, so to increase natural surveillance, and the violence as a result of that was largely eliminated in that area. And this is about effective violence prevention. So what do I mean by effective? I mean that prevention tactics and strategies which are known from authoritative trials, experiments to really work, not just back of an envelope, well, we think this works, but we know that these things work from past research. So targeted policing and CCTV, very important. Disrupting drug supply and gang activity, limits on alcohol and entertainment licensing, domestic violence interventions, and situational prevention, so park redesign, school-based child safeguarding, pedestrianisation of entertainment streets. So that's why St Mary's Street in Cardiff was pedestrianised, or a principal reason to increase the space for many intoxicated people on a Friday or Saturday night to move around. And then fast food outlet relocation, where fast food outlets are hotspots for violence. Now, helpfully, this was taken up by the coalition government in 2010, and NHS Digital in England published this Cardiff Model minimum data set. And it's a small anonymised data set with the items that I've already listed on violence-related A&E attendances. These information is available in every NHS trust in England, not in Wales, because we don't have the data set is not included currently in A&E software. A national and local data standard, again in England, but not so far in Wales. These data items were incorporated into the new emergency care data set in England in 2017, yet to happen, yet to be rolled out in Wales. And these data include a free text field for recording precise violence location in the kind of ways I've described. And relevantly, recently, 2022, the serious violence duty has been enacted, and this information sharing is a key part of the collaboration, which is now necessary, now mandatory. Now, a few examples now, and let's start off with London. So this is the Cardiff Model in London. On the left are the hotspots for violence which were identified from Metropolitan Police data. And on the right, there are the hotspots for violence identified from A&E data, and all 29 A&E departments in Wales, in London, are sharing these data with a central hub, and there are almost 3 times as many A&Es in London as there are in Wales. So if they can do it in London, we ought to be able to do it in Wales, shouldn't we? And the obvious conclusion from this is that many more hotspots materialize if these A&E data are studied. None of these 4 hotspots are apparent from police data, again, for the reason I've mentioned, that a lot of violence is just simply not reported to police. So there's an obvious lesson there. If the hotspots can't be identified, then they can't be targeted. Now we move to a bit more granular information in London. This is North London, that's the Homerton Hospital here, and A&E data showed that violence was concentrated in this small area here with the arrow. And when police were sent to that hotspot, identified only from A&E Cardiff Model data, it was found to be a crack house, somewhere where crack was being distributed and sold. So again, these hotspots can't be targeted unless they're identified, and A&E data, Cardiff Model data, is a way to do this. Now we move overseas to the United States, and 16 cities in the United States are currently implementing or preparing to implement the Cardiff Model, supported by the Centers for Disease Control, which is the federal public health agency in the United States. And this example is in Milwaukee. So Lake Michigan is top right for those with a geographical interest. And on the left, we have the violence hotspots identified from police data. And on the right, the hotspots identified only from the A&E department in the Children's Hospital in Milwaukee. And you can see here that there's a hotspot halfway down on the left here, which is only identified from Cardiff Model data. And when that was investigated, it turned out to be a school and the park associated with the school. So again, unique intelligence of obvious use in violence prevention. Now, the last example is from Kingston in Jamaica, where the Cardiff Model has been implemented by the government there. And again, on the left, this is Kingston, the capital of Jamaica. On the left, the police data, and on the right, there are data, Cardiff Model data from the A&Es in Kingston. And there are 2 big hotspots which are just not apparent from police data here in this Denham town area, and also around the Sir William Grant Park, which is actually a transport hub. So again, this information is obviously important for targeting hotspots. Now, does this approach work? And as an academic and a practitioner, it's been crucially important for us to evaluate this properly. And here's a graph that's published in the British Medical Journal a few years ago now. And what it shows is that as soon as we started and Cardiff started to use these hospital data to tackle violence, then violence in the capital city of Wales went down. And what's more, it stayed down. There was a sustainable benefit here compared to the other 13 cities designated as most similar by the Home Office. So it's an almost instantaneous effect of the use of these data. And hospital admissions went down in Cardiff and up in the comparison cities. That's hospital admissions just for violence, of course. And here's a graph of violence-related A&E attendances in Cardiff over the past 2 decades. And back in 2000, we were seeing about 80 victims of or people injured in violence in A&E in a week. And in 2019, it's gone down to about 30, 35. Then COVID struck. And if anybody's interested, after the meeting, I can share information about what happened to violence during the COVID lockdowns. In short, it went down and then shot up again once the restrictions were lifted. Now, there's evidence also that the Cardiff model for violence prevention reduces homicide. And this is a graph that was sent to me by Manuel Eisner, who's a criminologist at Cambridge University. And he pointed out, this just came out of the blue, nothing that me and my colleagues, researcher colleagues, discovered ourselves, but something that's come from externally. So at the time when this model was implemented in Cardiff, homicides went down, whereas in other cities, Birmingham, London, Leeds, Edinburgh, it went up. So there's evidence here that the model impacts on homicide as well. It's obviously clearly very encouraging. But these benefits are not possible through the model in other parts of Wales, simply because the data are not accessible, not collected, because the software doesn't yet allow that in A&Es in Wrexham and Rhyl and Bangor and Aberystwyth and other places. We carried out with actually a health economist in the United States a cost-benefit analysis, which has been published, and the cost-benefit ratio is very favourable. So in effect, spend £1 and you save 82 overall. And just in the criminal justice costs avoided, spend £1 and you gain 19. Now, but more importantly, I'd like to draw your attention to this Home Office assessment of Cardiff model impact, which was published in 2019, signed by the then Home Secretary, Sajid Javid, and this assessment estimated the cost savings for each community safety partnership as around just under £3 million per annum. So it's substantial savings. And of course, as I said at the beginning, these are savings from across the public sector, really, local government, health, and the justice system. Now, for those of you with a statistical mindset, there have been a systematic review and meta-analysis of evidence of Cardiff model effectiveness published independently. This one, led by Deakin University in Australia, concluded that all studies attempting to measure intervention effectiveness of the Cardiff model reported substantial reductions in assaults and A&E, that's emergency department attendances, with one reporting no change. It's about 10 evaluations they studied then. And public health academics in the University of Cape Town looked at this also and concluded that the introduction of the Cardiff model showed significant results in reducing assault. So those are available for anyone who's interested in the global evidence of effectiveness of the model. So coming to the end now, but how does the model work? Well, it works through earlier and more frequent police intervention, reduces harm. It identifies weapon trends, it informs weapon control, and there's been particular benefits in terms of the use of glassware and the switch to toughened glass and polycarbonate glass, as just as one example. And this is why in the United States there's interest in the Cardiff model in terms of gun crime, not surprisingly. Then it also works by identifying park, pedestrian and school violence locations, and that informs local authority actions in schools, in the pedestrianisation of entertainment streets, for example. It identifies and supports people injured in domestic violence, and that informs NHS Health Board actions. So there are actions here across policing, health, and local government. And I think importantly, this partnership activity increases accountability of violence reduction partners in a group or board of people who are responsible for doing this in the kind of way I've described. There's an accountability for violence prevention which doesn't exist if those partners don't work together. Now, what's needed in Wales to make this systematically beneficial across the country? Well, Cardiff Model data items are urgently needed in A&E data sets in Wales. And there are people involved here who know about how that might best be done. But as I say, if they can do it in London with 29 A&Es, then surely with 13, 14 A&Es in Wales, we can do this A&E by A&E if necessary, but hopefully across the country on an organised national basis. Then these data need to be sought and used operationally by police forces and safety partnerships in Wales. So we need to put the same effort into sourcing information and intelligence for prevention in this way as we do for the investigation of any serious violent offence, whether it's a homicide or other serious violence offence. So there's a demand here. Police forces and CSPs should be demanding this information and seeking it if really the objective is to prevent violence, which of course it should be. And then lastly, purposeful data analysis is crucial. Those data that I showed you need to be analysed, need to be pulled together, put in front of a board so that action can be taken. And again, if violence hotspots aren't identified, how can they be targeted? And Mark Rowley, the new Metropolitan Police Commissioner, has talked about the importance of precision policing. And this is one example of how that can be achieved. And so this is my last slide, a few resources, including the Centers for Disease Control toolkit published in the United States. This is a really excellent, excellent source. So thank you very much for your attention through all of that. Thank you.
Thank you very much, John. That was really helpful. And I think what we'll do after the webinar today, we'll send out those links to people who've registered so they've got that information to hand. I'd now like to invite John Drake, who's the Director of the Violence Prevention Unit in Wales, to give some insights.
Oh, thanks very much, Jennifer, and thanks, John. I really enjoyed your input there. So I'd just like to reflect on some of what John's talked about there, and just to give my sort of perspectives as the Director of the Violence Prevention Unit on the Cardiff Model. But also I'm conscious this is a policy forum, so how the Cardiff Model supports existing policy in Wales or likewise helps to develop it. So if I just sort of put my cards on the table, first of all, is I'm a massive supporter of the Cardiff Model. It's evidence-based, it's all about preventing violence, which is, of course, is what my job's all about. But I think when we look at what's at its heart of the Cardiff Model, it's all about multi-agency analysis, information sharing, working as partners together, and then producing some multi-agency action that can keep people safe. So, you know, in terms of a sort of an approach, it's a really, really positive way of doing business. So I'm Director of the Violence Prevention Unit. So our mission is to prevent violence across Wales through using a public health approach. And the important thing to say about a public health approach is the first step of that is around understanding what data's telling us using different data sources. They call it violence surveillance and epidemiology, but the point is really understanding all these different data sets to properly understand the picture of violence. And again, you know, in relation to the Cardiff Model, you've got an example there of using health policing, other partner data, crunching it together. So again, you know, a really good example of sort of an operationalizing of a public health approach too. I'll go further than that though, and just say, for me, from my perspective, so my background's policing. I was in the police for 30 years. I had the lead for intelligence the National Police Chiefs Council, and I also led on issues like counter-terrorism and serious organised crime in Wales. And what I would say is that in all that experience, I would say one of the key learning points for me is the danger of organisations working in individual silos. So, there's some really big public sector organisations across Wales and across the UK. And if we're to protect people, the way that we view harm has to be through that multi-agency, multi-data lens. It can't just be on the basis of, for instance, police crime figures, because they don't tell the whole picture, they don't tell the whole story. And there's a real risk then if you shape an organisational response to address harm around that really sort of one-dimensional view of what's going on in society. So that would be my sort of opening gambit. But again, I'd go further and just say there's some real evidence as well when we look at learnings from tragedy, where sort of the single lens approach has led to tragedy. So, an example would be the tragic death of Peter Connolly, baby P. So, one of the key findings there was around how information wasn't shared, a lack of openness and transparency in the way that risk was understood around that child, and obviously that resulted in tragedy. I'm conscious this is at a Cardiff University forum as well, so there was some fantastic work done in Cardiff University by Amanda Robinson, looking at some of the key findings from adult deaths in 2018. So there was an examination of domestic homicide reviews, adult practice reviews. What were the sort of common factors that may have contributed to risk not being understood properly. And a quote from that report is that the room for error increases when boundaries are crossed, or where there's a transition between one type of service user to another, from one service to another, or from one geographic area to another. So again, that report again really nails down the value of understanding a 3D picture of harm in society. Just in terms of the policy landscape in Wales, so where might sort of approaches like the Cardiff Model fit? So what I did have a look at was sort of 11 key strategic and policy documents in Wales. So I looked at things like the Youth Justice Blueprint, Female Offending Blueprint, some of the Chief Constable's delivery plans, all these different sort of strategic documents, all written by different people at different times and for different purposes. But what did they have in common? Well, they all recognised that their main driver was about the protection of people, about the prevention of harm. But all of them within it somewhere will talk about the importance of partnership working and information sharing. So, at a strategic policy level, in Wales, we have set our stall out that is the way that we want to work. And it's a case of how through things like the Cardiff Model, that policy is actually operationalised. So I'm director of the Violence Prevention Unit, and I don't know if people know about the unit, but we're a very small team, multi-agency with public health, policing, police and crime commissioners, and then we have an extended, what we call it, associate membership, which has over 30 different public and third sector agencies. And again, I would say that this is sort of an example again of the ethos of the Cardiff Model in terms of understanding harm from different lenses, different perspectives, and agreeing multi-agency action as a result. Just as an example of one of the products that we've done. So, we talk about health sharing data, but, the other way around is what's the impact of violence on the NHS year in, year out? Because obviously it's good to share data to prevent harm, but there is actually a direct business impact on the NHS day in, day out. And we did some research on what that cost is. And in a year, we understand that the NHS in Wales, it costs them about £200 million per year in terms of the cost of violence. So that's the cost of treating violence, sending ambulances, dealing with the follow-up, issues from post-traumatic stress, treating that, etc. So up to £200 million a year, each and every year. So it's a big, it's a big cost is violence to the NHS. One of the ways that we use multi-agency data at the moment is each quarter we crunch together all different data sets from all these different partners we work with, but particularly we value the data that's obtained from accident and emergency departments in Wales to really understand the true picture of violence in our society. And just as a very sort of a clear example of where that's brought benefits is post-COVID, when young people started going back to school. This data identified a real prevalence of schoolyard-based violence. So young people going to A&E being treated for injuries that had actually occurred either on the way to school or in the school premises or grounds. But really importantly, that wasn't evident from police data. Most of that wasn't reported in any way. And obviously, as a result of that, we were able to work with education partners to understand more around the data and obviously try and mitigate some of that harm. But it's interesting that that wouldn't have shown through any other approach. So anyway, I come back to the fact from my perspective as director of the Violence Prevention Unit, I'm very supportive of the Cardiff model. I think it's a really clear example of this desire to work in partnership, to look at harm through a 3D lens, and importantly, to use that data to try and prevent harm to people across Wales. So it continues to provide a really exciting opportunity to prevent violence and indeed, inform other pieces of work, certainly that we do. We're very proud of the fact that the Cardiff model was invented here. So that's my response, and I'm really happy to take questions, as I'm sure John is. So diolch yn fawr.
Thank you very much, John. That was really helpful.